Episode 38 F1 of 2 Wendy in Colombia, South America, PM 2.5 COPD. Wendy noted that in the medical journal Lancet, a journalist reporting from Bogotá stated that in Colombia, without a doubt, exposure to biomass and wood smoke is an important risk factor in rural areas, especially those where kitchens still operate inside, and huge numbers of Colombians have chronic obstructive pulmonary disease, COPD, driven by tobacco use and air pollution. The article asked the question, what is required to achieve COPD control? For maximum effect and to ultimately eliminate the disease, new COPD therapies must be precise and target the specific molecular pathways or endotypes responsible for disease expression. These therapies might be more effective versions of the inhaled or orally administered small molecules that are already available, but could also include stem cell or other regenerative approaches, nanotechnology delivery systems, or gene therapy. Available treatments improve some important disease manifestations. But several needs remain unmet, including the elimination of respiratory symptoms and tissue inflammation, reversal of airway remodeling, lung regeneration, and control of secondary systemic pathology. The influenza vaccination could reduce COPD exacerbations. COVID-19 vaccines are likely to reduce infections in patients with COPD. All public health workers need to recognize that the effects of primary prevention measures are immense and incomparable to any treatment that could be offered to patients with already established COPD. Indoor pollutants. The health effects of indoor air pollution related to indoor energy sources, residential wood burning, are substantial, and improved management of this lifelong risk factor will help to eliminate COPD. Wood smoke adversely affects respiratory health and disproportionately affects women and children in low-income settings. Installation of kitchen chimneys and improved biomass stoves reduce the effects of indoor air pollution. Improved stove and ventilation system designs also attenuate lung function decline and reduce the incidence of COPD. Interventions to replace biomass stoves with clean fuel, biogas, or liquefied petroleum gas stoves were unsuccessful in the long term because of financial and infrastructure problems, low awareness, and sociocultural barriers. Interventions to move away from biomass towards cleaner fuels are not always feasible in rural communities or for those with low socioeconomic status. Mary noted that the focus of residents against wood smoke emission particulates, ROSEP, is on the health effects to near neighbors of living next to residential wood burning, in those hyper-localized areas where the source of particulate pollution, PM 2.5, is concentrated. PM 2.5, particulate matter of 2.5 micrometer size, is the perfect size to infiltrate the human lung, causing a cascade of human health problems. Wood smoke consists of 90% PM 2.5. Residential PM 2.5 monitors can be purchased by neighbors from Purple Air for less than $300, and their locations are put on the online Purple Air map, along with data uploaded every 10 minutes, available to the general public, and of course, to governmental authorities. Neighbors of residential wood burners would like their Purple Air PM 2.5 monitor data to be used to regulate and shut down residential wood burning detected at neighbors' fence lines that exceeds the World Health Organization, WHO, standards of 5 micrograms per meter cubed or future U.S. standards of 8 micrograms per meter cubed. There could even be court-ordered monitoring using a neighbor-owned Purple Air PM 2.5 monitor as a breathalyzer, similar to car breathalyzers court-ordered for repeat drunk drivers, to turn off the ignition of a neighboring indoor wood stove when levels of PM 2.5 in a near neighbor's yard is exceeded. In this way, governmental authorities would not have to check the make and model of an appliance and would not have to rely on unreliable certification and other worthless assurances of levels of wood stove particulate emissions by the company that manufactured it. Purple Air monitors also provide data every 10 minutes 24 hours a day, and data can be downloaded from the map by governmental authorities the day after the PM 2.5 levels are exceeded, during normal government working hours. Purple Air PM 2.5 monitors are so reliable and accurate they are put on U.S. Air Now smoke and fire maps alongside $100,000 Environmental Protection Agency, EPA, monitors, correlated to the EPA monitors with a simple mathematical formula. But to publicize this, it is necessary to point out that living hyperlocalized next to a residential wood burner is essentially the same as living hyperlocalized next to any kind of PM2.5 emitting wood burning appliance, next to a PM2.5 emitting wood burning wildfire, or next to a PM2.5 emitting industrial biomass wood burning facility.